Today I want to talk about glaucoma. There's an eye defect known as glaucoma. Do you know why I chose this topic? I've realized that in most families, people are either hypertensive or diabetic, and this is a predisposing factor to this eye condition. So that is why I chose this topic because it's common, it's within us. Okay, so by way of definition, glaucoma can be defined as an eye defect that is characterized by irreversible loss of vision or blindness as a result of damage to the optic nerves. Okay, as a result of damage to the optic nerves. So that is what glaucoma is all about. Remember, this is the second most leading cause of blindness, irreversible blindness worldwide. There's the other eye defect they call cataract. I'll talk about that one later. But this cataract, it doesn't cause irreversible blindness. It can be reversed. But this glaucoma, the damage done to the eye cannot be undone. Okay, that is why it is called irreversible cause of blindness. Then, what are the causes of this glaucoma, if I may ask? To me, from my research, the cause is unknown, is of unknown etiology, but there are predisposing factors that can, make someone at risk of having this glaucoma. Number one is age, advancement in age. People that are up to 40 years and above, they are predisposed to this condition. The second one is genetic genetic predispositions. Some people, it runs in their family. If your mother or your father or your grandparents has suffered glaucoma, you are at risk. So you have to start checking yourself on time to avoid the story that touches the bum bum. Okay? Then the next predisposing factor is there are some medical conditions that can predispose one to glaucoma. I've talked about it before. Number one is hypertension. The other one is diabetes mellitus. So if you have someone or your parents that has this condition, if any of them they have this particular condition, you have to start going to the hospital on time to check for their what intraocular pressure. We call it tonometry. I'll talk about that later. So these are the predisposing factors to what glaucoma. Another one could be trauma. If there is trauma to the eye, it can lead to what secondary glaucoma. Okay, then another predisposing factor to glaucoma is use of some drugs. When some drugs are being used for a long period of time, there's group of drugs called corticosteroids. If they are being used for a long period of time, it can lead to this what glaucoma. So I've talked about the causes slash predisposing factors. Then that will lead us to the types of glaucoma. There are numerous types of glaucoma, but we're talking about open angle, angle closure, and juvenile glaucoma. The open angle glaucoma, this is the type of glaucoma that is common among people. It's common among people. It means that greater percentage of the population suffer this type of glaucoma. And this type of glaucoma, its development is usually gradual. It has a gradual onset and it usually causes damages unknown and it goes unnoticed to the extent that the person suffering this condition might not even know that he or she has this open angle glaucoma. Okay, so what normally happens is there is a fluid of the eye known as the aqueous humor. So this fluid is being produced by the ciliary bodies. Okay, so then there is an angle between the iris of the eye and the cornea. Okay, this angle is where the this iris and cornea join together. Okay, and this angle is known as the drainage angle, also known as the trabecular meshwork. So this is the place where this aqueous humor is being drained. Okay, so what's now happen in a person that has open angle glaucoma? This drainage angle is not closed. From the name open angle, it means that the angle is open. But there are other parts of the drainage canal that are not functioning effectively. It means that the fluid is moving out, but not completely. That is why its onset is gradual because it's a gradual process and There's the accumulation of the intraocular aqueous humor there can lead to increase in the intraocular pressure. Is a gradual process, doesn't happen suddenly. So once this fluid is not moving out effectively as it should, there will be accumulation of this aqueous humor, which can build up pressure in the eyes, and this is termed as increased intraocular pressure. So this increase in intraocular pressure will exert pressure on the optic nerves. Optic nerves are the nerves that sees to the eyes. So this pressure on the optic nerves can damage the optic nerves, leading to what? Irreversible eye damage. So the second type is open and close angle glaucoma. From the word close angle, this type of glaucoma is less common, and then it has a sudden onset. Okay, so what happens is that, remember I said that this drainage angle is formed by the iris and the cornea where they join together. Okay, so in this condition now, this close angle glaucoma, what happens is that the iris bulges. So when this iris bulges, it causes occlusion in this drainage canal. It means that the aqueous humor is not being drained. So it accumulates faster, and that is why the effect or the symptoms are sudden. Okay? So it will now lead to increase in the intraocular pressure and damage to the optic nerves and all whatnot. So that is open angle glaucoma, the close angle glaucoma, sorry. So that is close angle glaucoma. Then the third one is juvenile glaucoma. You know, for the fact that children suffer from diabetes and hypertension means that they are also at risk of glaucoma, because diabetes and hypertension is one of the predisposing factors to this eye defect. So you have juvenile glaucoma, meaning that children can also suffer from what? Glaucoma. So what are the symptoms? Those things that if you see, it could give you a clue that maybe you have this condition. Number one is increase in the pressure, increase in the pressure in the eye. Like when the eye pressure increases, you notice that you are having pains in your eyes. Ọ dịghị ka anya ga na anyị ga-alọ is a sign. If you are having blurring of visions, like you are not seeing clearly, for instance, you are in front of a mirror and you notice that the mirror is not bright, that the mirror is blurred. That is similar thing with blurring of vision. Your vision is not clear, it's blurred. Okay. Then another one is double vision. We call it diplopia. Even the mothers na ha na-afọ ebuo. That is diplopia. Then another one is severe headache and then tunnel vision. What I mean by tunnel vision is that the individual will be seeing just what is in front of them without seeing both ways. There's the sideways. This is because of, as a result of the damage to the optic nerve. So the next point is on diagnosis. How can this be diagnosed? There's what they call tonometry. Tonometry is just like a procedure that is being carried out in the eye to check the intraocular pressure. Okay, it's being done in hospitals like in UNTH. They have eye clinic and they do it. There are other hospitals they do the IOP. Check it. There is a tonometry to check the intraocular pressure. Then another means of diagnosis is what they call ophthalmoscopy. It's just like a means of diagnosis whereby the damage to the optic nerve is being evaluated to know how extent the optic nerve has been damaged by this condition. So what are the treatment regimen? They usually use drug. They give them some drugs like timolol. Timolol is an eye drop. Okay, it helps to inhibits the secretion of aqueous humor, that's the fluid, the eye fluid, by the ciliary body in the eye. Okay, so that's the mechanism of action. There are so many eye drops they use depending on the what the doctor prescribes for you. Then another treatment regimen they use is laser therapy. They use laser to promote the what's it called, the drainage of the aqueous humor. That's the role of laser. But if laser and drugs, that's eye drops and all that, didn't work out, they might go for surgery as the last resort. So let me end by saying this: if you are hypertensive or diabetic, or your parents are hypertensive or diabetic, please make sure that from time to time you go to the hospital